Good afternoon, everyone. My name is Joe Alabek, and I'd like to thank you for joining me here today. I'd like to start out this presentation with a quotation from Paul Marciano, co-founder of Guess Incorporated. He said that engaged employees are in the game for the sake of the game. They believe in the cause of the organization. And I'd like you to keep that quotation in mind, as you will soon have an appreciation of its meaning as I go throughout this presentation. Personally, I work for Edwards Life Sciences, a company that manufactures cardiovascular medical devices. More specifically, I'm a clinical educator working in the field in hospitals to train physicians on the use of a new and revolutionary heart valve product called a transcatheter heart valve. The device was first introduced in the United States market in 2007 and is changing treatment protocol for patients with aortic stenosis. Taking a step back, cardiovascular disease is the leading cause of death in the United States, and aortic stenosis is a contributor. The human heart has 4 different heart valves, the aortic valve being arguably the most critical as it controls the flow of blood from your heart to the rest of your body. It supplies the oxygen your body needs. As a person ages, the aortic valve can narrow and harden, causing loss of function and leading to symptoms such as shortness of breath, fatigue, and chest pain. For some time, the standard treatment for heart valve replacement has been a surgical approach. The patient is put to sleep. The heart is accessed by cutting through the rib cage. The physicians take a sternal saw and cut through the ribs. The heart is stopped with medical equipment called cardiopulmonary bypass equipment. The heart is actually bypassed, so flow goes around the heart through a machine, so the heart is stopped and the physicians can intervene. The physicians then remove the patient's failing heart valve and sew in a replacement heart valve device. This can be a rather invasive procedure, as you can imagine, with long recovery times for patients, potentially a couple weeks. With the introduction of this new product, there are many attractive benefits. The patient can be awake during the procedure. It's called conscious sedation. They are heavily sedated but actually awake. The heart is not stopped. It's a beating heart procedure, and there is no intervention through the rib cage. Rather, the replacement heart valve is loaded onto a balloon catheter and delivered through an access site near the groin in the leg. It's threaded up through their cardiovascular anatomy and into the heart. And the balloon is inflated and the heart valve gets put in place that way. Patients are up and about as quickly as that same day and leaving the hospital shortly thereafter. And the beautiful thing about my job is I get to take part in this experience every day at work. I scrub into the operating room to work with the physicians to treat these patients. I prepare the medical device, this transcatheter heart valve, and guide the physicians through its use during the procedure. I am literally the last point of contact between Edwards Life Sciences and the customer, who is the physician, and I get to see the benefits of what our company does for these patients on a daily basis. So needless to say, it's a very rewarding role and the most engaging job I've had thus far. In fact, I'd find it very hard to believe that if someone told me in the future I'd find an even more rewarding job. Just seeing the benefit that what I do on a daily basis, the direct benefit that it has on patients is amazing. And this brings me to the bottom line of my presentation here today. I have worked with Edwards Life Sciences for nearly a decade, the last 4 of which I've spent in this field role. However, the first half of my time with Edwards, I actually spent internal in engineering and marketing. And not to say that these roles weren't engaging, I enjoyed them very much, but seeing, as I mentioned before, seeing these products directly benefit the patients on a daily basis, it's at an entirely new level. You get to see the output of what the company does directly. So if there was one thing I could change about the company, and I wouldn't even call it a change necessarily, I would maybe call it an addition, because they currently are very, do what they can to keep their employees engaged. So this would be an addition to that. That addition would be to get more employees out into the hospital setting to witness these types of procedures, just in an observatory role. There's so many different functional roles at a company, at Edwards Life Sciences, at any company, and so many people don't get the opportunity to see the direct impact that what they're doing has on a daily basis. They don't get to see the good that comes out of what they do every day. So I think such an experience in the field would further engage employees, and it would directly highlight the importance of what they do and what the company does to help other people. In turn, this would provide a renewed sense of vigor to the employees, and this would further benefit the company. So if we take this back to Paul Marciano's quote, engaged employees are in the game for the sake of the game. They believe in the cause of the organization. Well, our organization does have a great cause to help people directly, help improve their lives, help hopefully to extend their lives. And so if you can engage your employees more and help them understand and see this, highlight this direct benefit, it's only going to benefit them and the company as well. I'd like to thank everyone for their time today, and I hope you enjoy the presentation. Thank you very much.